So, hello everyone. Thank you, Serim, for inviting me to speak about an important topic, or a challenging topic actually, because we are dealing with cases of hyperpigmentation, which sometimes challenging us, first of all, in its diagnosis, because the core golden rule in treatment of any hyperpigmentation is to reach the correct diagnosis of the case. And we have variable causes of hyperpigmentation. So first of all, we have to diagnose the case to give her a right treatment, because we saw yesterday in a dermoscopy session there is a lot of hyperpigmentation cases that can be misdiagnosed as any case of melasma. So we have lichen planus, we have ashy dermatosis, we have a lot of dermatological condition with hyperpigmentation. So for me, I found that the right to give the patient the right treatment or right product, first of all, is to give a correct diagnosis, to reach the correct diagnosis. Then after that, we will put a plan of treating such patient. So today, I'm invited to speak about one of the products that I'm personally in love, the Thiamidol, that's coming from Eucerin. After 10 years of researches, they are talking about a new science in treating hyperpigmentation with different molecule, which is the Thiamidol, or the life-changing molecule in treating the hyperpigmentation. And why it's life-changing? Because we actually using it since 3 years, and we have a very good feedback from our patient, and really we are confident enough to prescribe to our patient this kind of molecule. So the Thiamidol came after 10 years of scientific researches. It was the first and best human tyrosinase inhibitor, and it was researched and studied compared to other molecules available in the market as a treatment of hyperpigmentation, and they found the component that block the human tyrosinase, not the other kind of tyrosinase. So they tested it with 50,000 compounds, and they found it, and by researchers proven that there is actually the treatment will appear after 2 weeks of using the product. So we know as a dermatologist there is different causes of hyperpigmentations, and the hyperpigmentation is not only a melasma, which is the main cause of hyperpigmentation, but there is different cause. And what is the main factor for secreting the melanin pigment is the melanocyte. The melanocyte that's resting on the basement membrane, secreting the melanocyte by the presence of tyrosinase enzyme. So this is the factory of formation of melanin. So the pigment is actually produced inside the melanocyte cell and transferred through the arms of the melanocyte, which is 36 arms extended in the epidermis, giving the melanosomes to the other keratinocyte, and the pigment will be concentrated on the superficial layer of the skin, and even sometimes deep pigmentation. And we know that from the researches and literature that all the cases of pigmentation is mixed pigmentation, epidermal and dermal pigmentation. So this is actually the factory of formation of melanocyte, of the melanin, which is the melanocyte that contains tyrosinase enzyme. So how to treat the condition? Actually, we have different modalities of treating the hyperpigmentation. The one of them is the peeling that we are using in our clinics. Different clinic use peeling, and other keratolytic agents that we are using it to peel out the superficial layer, but it's actually not enough to stop or to treat the hyperpigmentation. We have actually the main treatment is inhibiting the factory, stopping the melanocyte from formation of more melanin. So our enemy actually in the hyperpigmentation is to block the tyrosinase enzyme. So blocking the tyrosinase enzyme is the main treatment of hyperpigmentation. So inhibiting it with different kind of molecules, and one of them, of course, the hydroquinone, which has a lot of benefits of treating the hyperpigmentation, but also has a lot of side effects. So inhibiting the melanin formation by tyrosinase inhibitor proven to be specific, safe, and most effective treatment of hyperpigmentation. And actually, there is a lot of researches from 1970 till 2020 going through different molecules for inhibiting the hyperpigmentation until we have a new molecule to inhibit this tyrosinase enzyme. And all the molecule was tested on the mushroom tyrosinase. And why is that? Because mushroom tyrosinase more or less similar to the human tyrosinase. So all the molecule was tested again for inhibiting the mushroom tyrosinase, not the human tyrosinase. So actually, this is the challenge that Eucerin took the challenge and tried to research this for 10 years to find a molecule to inhibit the human tyrosinase, not the mushroom tyrosinase. So finding out or extracting the tyrosinase enzyme was not an easy task for Eucerin. That's why the researchers took 20 years from them to have a molecule that can be extracted from the cell, and they can do their researches on them, and they keep this enzyme viable to use it and research it with different 50,000 molecules to find a molecule with a specific formula to block this human tyrosinase. So they came with the Thiamidol after using this 50,000 molecules to block the tyrosinase enzyme, and they found the molecule, this one, it's very difficult to be pronounced, but they put the abbreviations of it in the name of Thiamidol. So Thiamidol now is the molecule that inhibit the human tyrosinase, not the mushroom tyrosinase. So why the Thiamidol is unique to inhibit the tyrosinase? Because actually it can fit all the active molecule in the tyrosinase enzyme by its specific formula. So it can block the human tyrosinase, and during the researches, they comparing the Thiamidol with other molecule by the IC50. What is the IC50 is the concentration of the molecules that can inhibit 50% of the tyrosinase enzyme. And they are comparing different kind of molecules that we already using in treating hyperpigmentation, like resorcinol, kojic acid, arbutin, azelaic acid, and even tranexamic acid. And they found that the Thiamidol shows higher efficacy than the various well-known dermatological active component, but with low concentration. So low concentrations of the Thiamidol can be compared to the other molecules that can inhibit the tyrosinase as well. But using low concentration gives them the beneficial effect of less irritation and less side effect of the molecules that we are using. And also, they found that the Thiamidol was the best inhibitor of human tyrosinase out of 50,000 molecules that already they tried. And you can see here in the comparison that the other molecules work well on mushroom tyrosinase, but they are not working in the human tyrosinase. Only the Thiamidol can work perfectly on the human tyrosinase. That's why it can fit all the kind of hyperpigmentation that we can treat. And actually, what's unique regarding the Thiamidol, it can work within first 2 weeks. So you can see the result of the treatment within the first 2 weeks, which is give the patient confidence to continue using the same product, and also with low concentration. So the result will start within 2 weeks, and 70% of them will improve after 12 weeks. As we know that the hyperpigmentation is just not a simple treatment. We have to continue the treatment after initiating it. So the time regarding the safety, so using it with high efficacy is very good, but the safety for us as a physician is very important, or sometimes it's a priority for us to choose a safe molecule. The Thiamidol is proven by the study that it is safe and can be used all the year long. And we know that from the previous molecule that we are restricted in time, maybe 3 months of using hydroquinone, that we know a lot of side effects of hydroquinone. But using it for longer period, giving the Thiamidol high safety, so we can use it even for the pregnant ladies that have tendency of pigmentation and also the lactation. That proven from the study from Eucerin. And we know that the pigmentation is not only secretion of melanin, it also has a lot of other causes, like the pollution outside affecting the cells and the inflammatory condition, reactive oxygen species, the visible light that affecting most of the cases of hyperpigmentation. So we don't need only a product to block the tyrosinase and inhibit the pigmentation. We need also anti-inflammatory molecule to inhibit the reactive oxygen species that lead to activation of more melanin production. So we need another molecule with in our hand to also take the other causes of pigmentation, which is the leucocalcone A. The leucocalcone A in the molecule also has a lot of benefit. It has anti-inflammatory effect because it will reduce the TNF alpha and the interleukin 6. Also, it has antioxidant effect, and also will reduce the vascular impact. And we know that from the pathogenesis of melasma that there is a vascular element in melasma. The endothelial cell will also secrete some inflammatory mediator that lead to more stimulation of the melanin pigment. So also we want a reduction of the vascular impact of the hyperpigmentation by reducing the endothelial cell activity. Also with the leucocalcone A, it will work on the endothelial cell activity and work as anti-inflammatory, antioxidant, will work on the reactive oxygen species and the metabolic inflammatory pathways that accumulated in the cell, and also will reduce the vascular impact of hyperpigmentation. So we are working in the factory itself and working in the other causes of hyperpigmentation. And it is not only the information come after a lot of studies that published from Urserine side about the Thiamidol and proven its efficacy in treating this kind of hyperpigmentation. So the main key opinion leader in the worldwide are supporting using the Thiamidol. It's published in many publications and many surveys, and the Thiamidol is included in the treatment guideline from all over the world as a main cosmetic ingredient. So what about the cosmetic procedure that we are doing in the clinic for treating the patient of hyperpigmentation? We are using a lot of Q-switched laser for treating the pigmentation. If the Thiamidol will give us a benefit of combining it with the Q-switched laser, and what about the complication of laser? We have a lot of patients with post-acne pigmentation, post-laser hyperpigmentation, so we need to treat this kind of pigmentation. It's also done from Urserine side that the Thiamidol can be used as a synergistically with treatment of pigmentation itself with different kind of laser, and they did their publication. They exposed the skin to the ultraviolet and prepared the skin 3 weeks before using the Thiamidol, and they comparing it with the area not prepared with the Thiamidol. And after doing the study with these patients, they found that significantly there is less hyperpigmentation when we are preparing the skin with the Thiamidol 3 weeks before doing the lasers to avoid the hyperpigmentation. It's also proven in the study from Urserine that it can be giving a synergistic role of if we are preparing the skin with the Thiamidol before doing the laser treatment. So combining even pigment perfector dual serum in the Urserine range with laser treatment give a greater reduction and faster improvement of hyperpigmentation. And this is also published in the study. This is a plate phase study, done randomized study. They put to the patient, part of them they took as a preparation with the Thiamidol, and they are treated with Q-switched laser only. The other group of patients, they are using the Thiamidol plus the Q-switched laser in treatment of their hyperpigmentation. And they concluded that combining the Q-switched laser with the Thiamidol therapy, they are more superior of using the laser only in treatment of hyperpigmentation. And the other study was treating the post-laser hyperpigmentations. As we know that a lot of patients has burn after laser, even laser hair removal or different kind of fractional laser. They are coming with post-inflammatory hyperpigmentation. And they did this study, and the conclusion of the study is treating the post-laser hyperpigmentation is faster and giving a good result if you are using the Thiamidol product as a treatment of laser complication. So now proven by 2 randomized study from Urserine side that the Thiamidol is superior, combining it as a treatment of hyperpigmentation and also treatment of post-laser hyperpigmentation. So the Thiamidol success story came after the years of researches, and they are comparing it with a different molecule of hyperpigmentations available in the market, and they proven its efficacy, the higher efficacy than any other cosmetic product. They are comparing it with a known product available in the market. So it's effective, that proven by their study that it will reduce the hyperpigmentation, but mild or skin with first visible result within 2 weeks. I believe giving the patient molecule to improve his pigmentation in the first week will let the patient continue the treatment till 12 weeks, till gaining all the results. And it is life-changing power because it will start to show the efficacy within the 2 weeks, but also it will give 75% reduction in the pigment after 12 weeks, with 91% improvement in the quality of life. As we know that the pigmentation problem will make the patient affect the quality of patient with this condition as compared to psoriasis, acne, or different skin conditions like atopic dermatitis. It's one of the diseases that affecting the quality of life. So improving it with a molecule gives the patient improvement in his quality of life with 91% that proven with the study. So it's loved by all the dermatologists. I'm believing that I'm using it since 3 or 4 years. I'm personally using the product for myself because I don't like the peeling. So with this nice product, it will improve the pigmentation with less peeling. And how to use it, actually, we can use it for the face or the body. And of course, we have to use sunscreen. The beauty of Eucerin range is that they have all the portfolio of using the molecule with the pigment, with also the sunscreens that contain the Thiamidol, and also the different range that you can mix and match as the patient demand, because some patients cannot afford to have all the range. So you have all the option in your hand. So they have a different molecule actually, and the new one is the one for the eyes. And we know that the dark circle is one of the problems that we are facing. So giving the patient this range with the new molecule, I'm really want to try it with my patient, is the new one from Eucerin coming also for the dark circles. So this is the whole range of the Thiamidol. So you can use the morning cream with SPF, the sun protection with the Thiamidol, the morning melanocytes. Means if you are stopping the product, the melanocyte is still working and the pigment will still secreted. So it is not, it's compared to the other toxic effect of the hydroquinones that usually we are giving the patient a notice that you cannot use it with more than 3 or 4 months. It's also tested, but a lot of publication proven its efficacy, and it's safe on pregnant and lactating. And it's also challenging to give the pregnant lady that's prone to pigmentation, because a lot of hormones secreted and lead to more, it's prone to hyperpigmentation. So it's safe on pregnant and lactating ladies. So I believe that now we have a molecule that's safe to be used. We can use it for longer period. We can keep the patient if we are doing a cosmetic procedures in the clinic, like peeling, like fractional laser. We can prepare the patient with the Thiamidol, and we can also continue the treatment of hyperpigmentation with the Thiamidol range, and you are free to use whatever range is suitable for you. So with this nice portfolio of Eucerin, we came to the end of the symposium. If you have any questions, I'm ready to answer.